I'm not a doctor, so it's all going to be in like real simple layman's terms, hopefully, and hopefully it'll mean you can understand it a little bit more. Well, so the transplant basically is supposed to reset your immune system. So the idea is that you get rid of your old immune system that isn't working, that's giving out bad signals, set it back down to its original, and then give the new stem cells, and it'll start to make you a new immune system, but hopefully not with the bad instructions that it had before. Like we've just heard, the stem cells aren't actually what do the job. The chemo is used to switch off the bad instruction, which I'll speak about in a minute, and the stem cells are actually not treated in any way. They're just taken from your own body, frozen, defrosted, and put back in you. I don't know what's going on with this. Okay, there seems to be some slides missing. Anyway, for those of you that don't know me, I'm Katrina Brown. I was diagnosed with systemic sclerosis in 2008. I had all the usual symptoms, started with Raynaud's, stiff joints, tight skin, all the other fun things that go with it. And at the end of 2008, I had to give up work. I worked in the operating theatre, and it was unsafe for patients because my hands didn't work, my wrists didn't bend, couldn't perform CPR, couldn't do anything really. And until about 2012, I thought that was it. I was taking Celcept, I was keeping myself as fit and healthy as possible, but I was declining slightly every year, and there was nothing really else that I'd heard of in form of treatment-wise. And then in 2012, I had a friend diagnosed with MS, and that's when I really heard about stem cell transplant. I think it was being done more in MS patients because the risk is lower because they don't have the internal organ complications that we have. So I looked into it, and the aim of it really is just to stop the progression. It's not meant to, although a lot of people get good results from it, it's not meant to be a promise that it's going to be a cure. It's not meant to reverse lung disease. It's not meant to make your skin go soft. It's not meant to do any of those things. It's just meant to stop the progression where it is. And for me, that was enough. So I started looking into it. I found a Facebook group on about the stem cell transplant. They'd all been done in America by a doctor called Dr. Burt, and they were all having good results from it. Most of them were saying that not only had it stopped the progression, that they'd had better lung function afterwards, that their skin had started to soften, that they'd gone back to work, and everything else like that. I started looking into it more, got in touch with Dr. Burt. It wasn't available in the UK at the time. I did go and speak with a few of the doctors in the UK, but there was nothing that could be done here, so I had to look at other options, and Dr. Burt, for me, was the one that I trusted. He'd done it for 14 years, 23 different autoimmune diseases, and he'd had good results. So the pros of having it was that it was going to stop the disease where it was, and that the other people that I'd spoken to had had good results. But it is, as we've heard, it can be a life-ending procedure.